Good morning everybody, Chris from the Headache and Pain Management Centre here for your Monday morning, and it's National Headache and Migraine Awareness Week, and this is the first of 5 videos that we'll be releasing this week, and there's a lot of exciting content coming, actually something really exciting coming on Wednesday morning, so watch out for that as well, something very exciting Wednesday morning. But today we're talking about migraine, and we're talking about why migraine can swap sides from left to right, back to front, and why that's so important to getting a diagnosis and treatment for your migraine condition. If you are joining us, type in below, say hello, and join in the fun. Ask any questions that you might have along the way. So yes, when it comes to headache and migraine, migraine in particular, a lot of migraines can actually swap sides. So we know that migraine is a one-sided headache. Good to see you there. So it's actually a one-sided problem usually. Okay, sometimes it's two-sided, but usually it's one side. It can be in behind the eye, in your head, up and over the head. I can feel like that it's spraying out your eye, like it's exploding. And quite often what people report, and in fact it's 80% of people that report this as being the case, it can actually be on one side of the head, so it might be on your right-hand side one day, and then it can be on your left-hand side the next day. Or even during the same attack, it can start on the right and then finish on the left, or vice versa. And you get some really unlucky people where it's kind of like here one day, there the next day, there the next day, and it can move around all over the place. So what's actually going on when that happens? Now, here's the thing. In the manual, in the headache and migraine manual, the one that decides the diagnosis, what it is, it's called the International Classification for the Diagnosis of Headaches, for those playing at home. Basically, all it talks about is the one-sidedness of the pain as being the indicator, but it doesn't actually talk a lot about A, what it means, and B, what happens if it swaps around. Well, I'm here to tell you that if it swaps around, it's actually really good news for you. Okay, it's great news. And the reason why it's such good news is because most of the time, I'm talking like 98% plus of the time, it's actually your neck that's causing the issue. Now, how do we know that? How can we be so sure that if a headache can be on one side and swap over to the next, over to the other side on the next day, how can we be so sure that it's the neck that's the issue? Well, it all comes down to how the headaches and migraines sort of generate within the brain. So right at the bottom, just at the bottom of your brain, top of your spinal cord, there's a little area there that takes in all the input from all the nerves from your head, your neck, your face and your jaw. So effectively anything from here up and over to there. Now here's the thing, the only thing that can cause a headache to move around from left to right, right to left, the only thing mechanically that can make that happen is the neck joints, okay? So the joint between C2 and C3 specifically, right? So on one day what can happen, a muscle can spasm up on one side of your neck, causing those joints to be an issue, which then causes the pain on one side of your head. Okay, so if that spasms on one side, it will cause the headache on one side. If what happens, it moves and it spasms up on the other side, whack, then it can come on the other side. So if you have a headache or a migraine that swaps sides, it's really, really likely that your neck is the cause of it. And that's actually what happens. So we see that all the time here in the clinic. So if you've got a headache on one side, swaps across, it's probably your neck that's the issue. Now, if it's a 50-50, like it's always right, then always left and right, like it's really even one side or the other, what it generally means is that it's a two-sided thing, or what we call a central problem. So the way that your neck is moving, it's stiff in the front to back direction like this. G'day Kim, good to see you there. And Meg, if you need any questions, please type in below, I'm happy to answer. So when you actually draw your chin back, or you're moving in the front to back direction, that's actually the issue that's going on, because it can go left or right. So it's a front to back type direction. If there's an issue, for example, it's more like 80% one side and 20 the other side, then it could be a front to back thing, but it's more biased towards that side than the other side, okay? So most of the time it's an issue this side, but only sometimes it's an issue that side. And if you've got headaches that are only exclusively on one side, so say for example you've got something like a cluster headache or a migraine that always only goes behind one eye or on one side of the head, then it means that it's that one joint on one side that's always affected. So it's a more side to side problem rather than a front to back sort of problem. So we know how to assess that. We've been doing this for years, okay? We have a really good system to be able to diagnose and assess and treat that if we're actually going there. Let's have a look. Hello, Kelly. Going to get a spine surgeon to get evaluated for upper cervical instability. I'm interested to hear more about that, Kelly. I might even start a discussion with you offline. So when you've got the upper cervical instability, we want to make sure that the alar ligament, the transverse ligament are the ones that you're looking at. We want to make sure that they're the ones that are the issues. If they are issues, then yeah, sometimes a surgical referral is what's needed. Sometimes it's actually not, and it's actually the joint below it which is causing a bit of a red herring. But I am interested to talk to you more about that, Kelly. G'day, Robin. Good to meet you there as well. Good to see you. So yes, when we're talking about headache and migraine, when it swaps sides, it's a neck problem that's there. Most of the time it's actually a disturbance of the joints between C2-3, whether it's the disc itself, whether it's the joints, whether it's the muscles, and like Kelly there, occasionally it can actually be an upper cervical instability with the ligaments, which do need further assessment. And as I was saying before, the way that we assess things here is actually able to determine what the issue is. Okay, firstly, if it is the neck or if it isn't. If it's the neck, we look at it. If it's not, then we send you on. If the neck is an issue, we look through the joints, we look at the muscles, look at the discs to see what the main issue is when it comes to your migraine condition. If we can actually find that your migraine is coming from your neck, we then treat that accordingly. So I guess what we're talking about, the main point from today is that if your headache or migraine condition swap sides, then it's your neck that's probably the cause. So it's worth getting your neck skillfully assessed by someone who knows what they're doing when it comes to assessing necks. A scan's not going to show it, okay? All it's going to show is, a scan is a moment in time, whereas a neck is a movable entity which actually needs to be felt. It needs to be seen. It needs to be assessed really carefully to make sure that is the case. I hope that's been really helpful for today. If there's any more questions while I'm here, please type in below. As I said before, this week is National Headache and Migraine Awareness Week, and we're doing 5 live videos about that. And tomorrow is Tension Headache Tuesday. So we're going to be talking all about tension type headaches and the joint that's specifically affected more than any other and what you can do to help that out if you do suffer from tension headaches. And you saw the status from earlier this morning about all the other videos as well. We've got some weird condition Wednesday. We've got trigeminal and cluster Thursday. And then on Friday, we're talking all about the treatment options, both medical and non-medical, about how to get your headache and migraine conditions sorted out. I hope that's been really helpful for today. Hope everyone's having a really great Monday, and I'll talk to you again tomorrow for Tension Headache Tuesday for National Headache and Migraine Week. Cheers and bye for now.